Assalamu alaikum. Let's dive into the fetal heart rate, one of the most important topic in obstetrics, taken from the USML inner circle. Start with this intro, where you will see a patient. Can you guess the diagnosis? If you know, put it in the comment box. Okay, now fetal heart rate. If you look at this fetal heart rate, if you look at here, intrapartum fetal heart rate monitoring. Intrapartum fetal heart rate monitoring, it may be early deceleration, it may be late deceleration, it may be variable deceleration. Okay, how we can calculate? We know that one small square is 10 seconds. So this is the onset and this is the nadir, the highest point of the deceleration from onset to nadir 1, 2, 3, 4, 5. So more than or equal 30 seconds if onset to nadir more than or equal 30 seconds, and it is symmetric to contraction. This is fetal heart rate, this is uterine contraction. So fetal heart rate and uterine contraction, if it is symmetric, if it is more than 30, symmetric to concentration, nadir of deceleration corresponds to the peak of the concentration. The nadir of the deceleration corresponds to the peak of the contraction, and it is more than 30. There are two causes. It is early deceleration. Two cause fetal head compression can be of normal fetal tracing. It may be fetal head compression or can be normal fetal tracing in early deceleration. In late deceleration, from onset to nadir, if it is more than 30 and if it does not correspond, delayed compared to contraction, delayed compared to contraction, this is uterine contraction, this is, it is delayed compared to contraction, and nadir of deceleration occurs after the contraction. This deceleration occur after the contraction and it is more than 30. It is late deceleration, and the cause is uteroplacental insufficiency, UPI. And the variable deceleration from onset to nadir is less than 30 seconds, and abrupt decrease more than 15 minute duration, more than 15 seconds by less than 2 minutes. Etiology is cord compression, oligohydramnios and cord prolapse. Cord compression, oligohydramnios and cord prolapse. Cord compression, variable deceleration, return to the baseline, variable deceleration, return to the baseline, decrease in amniotic fluid after rupture of the membrane causes cord compression and decompression. Cord prolapse, abrupt, prolonged deceleration with no return to the baseline. Abrupt, prolonged deceleration with no return to the baseline. What type of deceleration may be indicative of fetal hypoxia and acidosis? What type of deceleration may be indicative of fetal hypoxia and acidosis? Late and recurrent variable deceleration rate and recurrent variable deceleration. This is the fetal heart rate variability. Fetal heart rate variability absent, undetectable amplitude, absent undetectable amplitude, minimal less than 5, minimum less or equal 5, abnormal or immediate pattern, CNS depression, temporary fetal sleep, prematurity, and fetal hypoxia. CNS depressant, narcotic, alcohol, recreational drug, temporary fetal sleep, prematurity, and fetal hypoxia. Moderate is normal pattern if it is 6 to 25 beats per minute. Marked is unclear significance. This is the fetal heart rate variability. If it is absent or undetected amplitude, clinical significance either abnormal or indeterminate pattern, CNS depression. If the patient is on CNS depression, narcotics, alcohol, recreational drug, or temporary fetal sleep, prematurity, and fetal hypoxia, these are the cause of absent or minimal fetal heart rate variability. Variable deceleration, it is cord compression or prolapse. Treatment intermittent if it is less than 50% of the contraction, no treatment. If it is more than 50% contraction, intrauterine resuscitation, oxygen and repositioning. Mom, delivery if fails, and late deceleration occurs after peaks of uterine contraction. Treatment is intrauterine resuscitation, oxygen repositioning. Mom if failure, amnioinfusion or C-section, and cord if there is cord prolapse, C-section should be done. What is the first line intervention for a woman in the first line intervention of a woman in the first stage of labor with recurrent variable deceleration and moderate variability? Recurrent variable deceleration and moderate variability on fetal heart rate tracing, that is maternal repositioning, left lateral decubitus all fours, maternal repositioning, left lateral decubitus all fours, amnioinfusion, installation of this cell line, installation of cell line in intrauterine cavity is a possible second line intervention. Assisted vaginal delivery would be indicated if patient was fully dilated. Assisted vaginal delivery would be indicated if patient was fully dilated. Amnioinfusion is contraindicated in a patient with a history of uterine surgery. Amnioinfusion is contraindicated in patient with a history of uterine surgery. Fetal scalp stimulation is performed to evaluate fetal acidosis in patients who have no history of who have no acceleration on fetal heart rate monitoring, not performed in patients with deceleration. Baseline fetal heart rate, fetal tachycardia, and fetal bradycardia. Fetal tachycardia is maternal fever, maternal side effect beta agonist, maternal fever, maternal side effect beta agonist, fetal hyperthyroidism, and fetal tachyarrhythmia. Maternal fever, medication side effect, fetal hyperthyroidism, fetal tachyarrhythmia, and fetal bradycardia is maternal hypothermia, maternal side effect, maternal hypothermia, maternal side effect beta blocker, fetal hypothyroidism and fetal heart block, fetal hypothyroidism and fetal heart block, anti-Rho, SSA, anti-Rho, SSA, and La. So fetal tachycardia, if it is more than 160, maternal fever, maternal beta agonist, maternal side effect, fetal tachycardia, fetal tachyarrhythmia, and fetal hyperthyroidism, and fetal bradycardia less than 110 per minute. Maternal hypothermia, maternal side effect, fetal hypothyroidism, fetal heart block. Fetal heart rate tracing patterns. Fetal heart rate testing pattern category 1, category 2 and category 3. Category 1, it requires all of the following criteria: baseline 110 to 160, moderate variability 6 to 25, no late or variable deceleration, early deceleration with or without acceleration. This is category 1. Not category 1 or 3, it is category 2 and category 3. 3 for C, that means CS for category 3. If there is one or more than one following characteristics, if one or more than one following characteristics: absent variability and recurrent late deceleration, absent variability and recurrent late deceleration, absent variability with recurrent variable deceleration, absent variability with bradycardia and sinusoidal pattern, absent variability with recurrent late deceleration, absent variability with recurrent variable deceleration, absent variability with bradycardia and sinusoidal pattern This is category cesarean section for category 3. This is sinusoidal heart rate. This is sinusoidal fetal heart rate. Okay, this is all about fetal heart rate. Hope you enjoyed.